The most common reason for dental professionals to miss work is respiratory infection. The use of high-volume evacuation has been shown to reduce aerosols that are generated during ultrasonic scaling by 90%. Dentsply Sirona's Purevac HVE system enables a one-handed approach to evacuate the patient's oral cavity of potentially harmful aerosols, splatter, fluid, and debris. The Purevac HVE has a reduced noise level compared to a standard HVE tip for patient comfort while providing retraction, visibility, and illumination to treatment areas. The following video is meant to provide helpful tips and tricks to maximize the use of the Purevac HVE system. The Purevac HVE's mirror is designed for visibility in areas of the mouth where you cannot see with direct vision. This video demonstrates some tips and tricks for maintaining visibility with the mirror. Prior to turning the device on, coat the mirror with saliva from the inside of the patient's cheek. In cases with dry mouth, Dentsply Sirona recommends polishing the mirror with NuPro Extra Care Fine Prophy Paste. These two tips will provide a surfactant on the mirror surface, allowing water to clear. Pausing briefly during ultrasonic scaling to allow the mirror to clear may also be helpful. The mirror of the Purevac HVE tip also provides the clinician with illumination to the treatment areas. The Purevac HVE mirror tip has smooth edges, allowing for improved retraction of the cheek and tongue effectively during ultrasonic instrumentation. The tips and tricks demonstrated in this video were developed as a valuable guide in utilizing the Purevac HVE system during ultrasonic scaling instrumentation. Please contact your Dentsply Sirona sales representative for additional support and information.